as Vice President for Health Sciences and Dean of the Jacobs School of Medicine and Biomedical Sciences at the University at Buffalo. I've had the opportunity during the last 20 months to work closely with the governor along with my colleagues Mark Sullivan and Tom Catroci and others, and so it's a personal and professional pleasure to have the opportunity this afternoon to introduce Governor Kathy Hochul. Governor.
Good afternoon, Western New York. It's great to be back. And Dr. Kane, I have to say, having been in the literal foxhole with you for nearly 20 months as we fought back this pandemic, day in and day out, your extraordinary leadership, not just as the Dean of the Medical School here, but also as part of our COVID response. From the very beginning, you just gave us that sense of calm. You answered questions professionally. You let us know we were going to be okay, and that was a profound contribution you made to this community that I care so deeply about. So let's give another round of applause to Dr. Kane for everything he's done. Also, that was a big foxhole. I was in it with Mark Poloncarz too. We came through a lot together. That whole era of uncertainty, the numbers going up, the restrictions, the lifting of some restrictions, and concern about where we're going. It's been a long journey, but you and all your members, Gail Bursty and others at the Department of Health, I want to acknowledge all the tireless work you've done on behalf of the people of this county and your contributions elsewhere. So County Executive Mark Poloncarz is here as well. And someone who is conscripted into our battle, once again, that foxhole, that big foxhole, once we started talking about the vaccine hub and how we want to make sure that we are very equitable in our distribution and how we are going to deliver the vaccine to communities, particularly communities that have been hit so hard by this pandemic, and that's mostly the black and brown communities. I want to thank Reverend Mark Blue, the head of the NAACP, for his great contributions in this as well as Tom Catroci, who is on the vaccine hub, our president and CEO of ECMC, Mark Sullivan, president and CEO of Catholic Health, and they did an extraordinary job. And I wish I could say the job was over. It's not quite there yet. I'd love to be here to declare an end to this war, but the numbers do not allow us to say that just yet. Also want to recognize Dr. Greg Young from the Department of Health, who's been on the front lines with us every single day. Thank you for your contributions. I know Dr. Thomas Russo, who's becoming quite the authority and has been answering a lot of questions and has been a tremendous resource for me personally as I ask him questions about how we're going to combat this. And Candace Moffins, I want to thank you for being the host here today, for welcoming us to the Delavan Grider Community Center. I will go through a presentation. We'll take some questions afterward, but I am concerned. I am concerned. I am here because I am personally deeply concerned about the rate of infection, not just here in Western New York, but we're seeing in the Finger Lakes and some other regions, and I'll go into the details, and then I'm going to send out a call to this community to help us change that dynamic now. We are heading into a vulnerable time. I want to make sure that we protect our kids in schools, keep our children safe, make sure people are safe in the workplace, safe when we gather for Thanksgiving. So I want to thank all of the individuals who are part of this. I also wanted to say we are seeing the spikes go up. We are seeing the numbers continue, over 8% here in Western New York, and a lot of it's concentrated in our rural areas. We're very aware of that. There is a direct correlation between people being vaccinated and the infection rate. It's extraordinary to think where we were a year ago. We had no hope. We had no weapons in our arsenal to fight back against this deadly pandemic. We are talking about a vaccine, praying for a vaccine, hoping that it would finally come, and it did come, where we were able to start vaccinating people in nursing homes and in congregate settings and our most vulnerable seniors. We finally felt we had some hope. And then through the spring, making sure that we had enough supply and making sure that we could get them out to people who, again, were vulnerable, but ultimately to other age groups and other populations. And all of a sudden, the supply was not a problem. It was creating the demand. We reached this turning point where there was plenty for people wanting to be vaccinated, but we just couldn't even get them out to enough people, and people started rejecting them. People were saying, I'm turning my back on this opportunity. They did not want to be vaccinated. That's why I believe we're having these numbers, we see these numbers here today. When you look at the numbers of positivity, the cases per 100,000, it's another way of looking at the numbers. It's a high number. We talked about these numbers when we were doing the control room meetings. None of us would have been satisfied with even half these numbers. And this is why we have such a high alarm here. We have over 5 regions that are above 50, over 50 per 100. And only one region that, last week there was only one. So in 1 week, we've gone from one region hitting those higher numbers to 5 of them. We also have hospitalizations. I loved it when the numbers were going low. You can see that number is starting to trend in the wrong direction. If it flat lines, that's one thing, but a week ago or a couple weeks ago, we had 206 hospitalizations in Western New York. Today we have 299. It's a lot of people. And the challenge we're facing, I speak to our healthcare leaders often, is that there's a lot of people in hospitals for other reasons as well. Many people put off necessary medical care during the pandemic. We shut down in order to create bed space. A lot of the elective surgeries were put off. A lot of people did not get their annual testing for the mammograms and other life-saving preventative measures and testing. All that went on hold. And as a result of that, people who may have been able to be taken care of at home or out of a doctor's office became very sick. So the combination of people sick with COVID, as well as the population that are taking up spaces because of the extraordinary circumstances I just spoke about, has really created a situation that is not sustainable. And here's our infection rates. I'm not happy about this at all. Infection rates are high. Our vaccination rates should be higher. I mean, there's no reason why we're not 100%. There's no reason. Children do not go into kindergarten unless they're vaccinated. There should be no fear associated with the vaccine. This is for children's safety. And we're starting to see the numbers up somewhat, but again, there's no reason. There's plenty of supply. We've created a network working with our local counties, with our doctors' offices, with our pharmacies, health providers. We have created a dynamic where anybody who wants to get a vaccine, it is available. So yes, these numbers are better than they had been. We've made some great progress. I want to thank everyone, particularly those who may have been reluctant on the front end to do this, but so the numbers are getting up there. We'll eventually hit 90%, but it's that 10% that's holding everybody back. That's what's so frustrating about this. It doesn't have to be that way. And now we have, been working for months and months to get the children for 12 to 17. The county executive just spoke about this. The highest number, or the category of ages of people getting the virus are the younger people now. They're not immune for this. There was talk a year ago that it wasn't really going to hit the younger kids. It was all about senior citizens, older people who are sick. That theory has been blown out of the water. Look at what we're having, the number of cases regarding young people now. Breakthroughs. This is very troubling. And it does not mean you should not get a vaccination. You must get that vaccination, and these numbers still verify that the vaccination is the safest thing to do, that when you are vaccinated, your chance of really getting sick or ending up in a hospital are dramatically decreased, dramatically. There's very few people, but there's still a number of people that are ending up in the hospital. The cases are starting to go up, and this is what is so concerning to us. So your chances of hospitalization are reduced by 95% if you do get the vaccine, but I can't tell you the number of people I've met. I called up a senator the other day, I called up a friend, the more people I'm talking to are having these breakthroughs. Now, the good news is there's a solution to the breakthroughs as well. And we'll get to that in a minute. So why is this happening in Western New York, though? Let's look at these numbers in Western New York and the Finger Lakes. Some of it's not rocket science. People are starting to head indoors. They're outside a lot over the summer. All the outdoor dining was fun. It's getting a little colder now. People are just getting more complacent and more casual. There was a time a year ago when you gathered with family, you had a mask on indoors. People were following those protocols. They were being smart about it. And when we look at our fully vaccinated rates of adults, statewide it's approaching a higher number, but the Finger Lakes at 72, Western New York at 70%. That's where the problem's lying, my friends. That's where the problem is right there. You can zero on that and say that is why we have such a high infection rate compared to other areas as well. And so we're even starting to see breakthrough cases with older people. They are very vulnerable if they get the breakthrough, and we have to make sure that they're protected as well. So we're approaching the holidays. What are our options? We have to fix it. We have to fix this. And I want to celebrate Thanksgiving safely. I want to know that when we get together, that we're not going to get one of our loved ones sick. We all went through this anxiety a year ago. We thought that was the last time. We declared by this time next year, I'm sure we'll be fine, we'll have that vaccine. And because there are still holdouts, we cannot declare that it's going to be completely safe. So how do we get rid of this pandemic? It is so simple. It is so simple. Get more people vaccinated and get the booster if you haven't had it. Wear a mask indoors, maintain the distance. And I know this is so frustrating because no one wants to hear this again, but we really should be avoiding large gatherings in indoor spaces. So let me talk about boosters, because there's been a lot of confusion about this and who's eligible for a booster. If you look at the numbers, we can look at the breakdown. There's room for improvement there. We definitely have the capacity, we have the infrastructure in place, and we have to make sure that more people are getting the boosters. Our seniors are vulnerable because their vaccine that they had, some of them just a little over a year ago, many of them were vaccinated in December and January, starting to wane. The efficiency of this is starting to wane. We saw that, we know that. So the way we can get it, we know that 47% of people 65 and older had a booster, 47% above 65. That's the population that's going to get sick and end up in the hospital. We have to make sure that they're getting boosters. Let's get those booster numbers up. We're going to continue working with our local health care facilities, make boosters available. This is what the state is committing to do. If our counties need help, we're there for them. I've said this all along. I will be there to make sure that you have the resources you need to have boosters available in any place that seniors gather. I want to see them available at senior centers. We're going to be having them even at this facility right here in a couple more days. We're going to have those available for children and for boosters. And if we can protect people with the boosters, we'll be better off. Now, I just talked about people over 65. That's what the rule is, right? Here's the news flash. We live in a high transmission area. This part of the state is a high transmission area. Therefore, there is risk associated with living in a high transmission area. Anyone who lives in these areas and feels risk, that they're at risk of catching this virus, they should go get a booster. I want to be clear about that. Live in a high transmission area, there is risk. If you personally feel that risk, and it'd be hard to imagine anybody who doesn't, because you're among people, you're at work, sometimes in public transportation, you should be getting a booster shot now. I want to be crystal clear on that. Everybody clear on that? You got the message. Get the booster. It has to be a 3-shot if you've had the Pfizer or Moderna. It has to be a 2-shot. You have to get the extra like I did and Reverend Blue did. We got the Johnson & Johnson, then we had the Moderna booster. This is how we get out of this, and thank God we have this available to us. There's plenty of supply. We'll get this out. That's how we're going to get through these holidays safely. And there's no reason not to. No reason not to. So if you have any questions about that, you can talk to your healthcare providers. We want to make sure that we're working with our local leaders. I want to commend County Executive Mark Polenkars and County Executive Adam Bello over in Monroe County. They spoke about this very clearly. And they spoke about, what will happen if the numbers don't go down. I wanted to be able to come here and declare this is over. The last thing I want to do is have to talk about more protocols that will be needed in place. So I'm giving everybody a chance. I'm getting the word out, saying this is reaching a situation that is untenable. The numbers are far too high. We have the answers. We have to get people vaccinated, get people the boosters, and I want our local health departments to know, and our local county executives, that I have their backs when they need to take steps to move forward and have more protocols in place as they do in some other parts of the state, particularly New York City. I will have your backs on this. I will support you, and I'll give you the resources that you need to make it happen. So let's get more shots in arms. Let's have more measures in place for social distancing and masking. And let's just talk about getting through this. Let's get through this. and it's all about working with the local leadership, because I know they're the ones who live and breathe this more than anyone. I'd love to be able to get through this winter with no more spikes. Everyone's tired of the masks. I thought I'd be able, at this point, be able to talk about removing masks in schools, but if there's no progress, we're going to have stricter measures. Talking about schools briefly. We do now allow children to remove masks during outdoor recess, outdoor gym, and while eating and drinking. There's a lot of controversy about when kids can take off masks. That is currently the protocols in the state. Children who are outdoors, recess, outdoor gym class, while eating and drinking. And while they're unmasked, they really should stay as close to 6 feet apart as possible. We also have allowed counties to do an opt-in to test and stay program. So we all know how critically important it is for kids to stay in school. We saw the decline in all these children across the state when they are relegated to sitting at home, with some cases without proper technology, without a parent making sure they got their work done, and they slid hard, they slid far, and they went down fast. That, to me, as a parent, is one of the greatest tragedies of this pandemic, in addition to the loss of life that many people experience. The loss of education for so many children. I want them to be in school safely. We know how to do this. And making sure that kids are vaccinated is the way to do it, and making sure that if there is a school, there's a classroom, let there be a protocol where children do not have to quarantine at home alone. If they test negative, they should be able to go back in school. We allow the local school districts to institute that. That is out there right now, and I encourage them to look at that to make sure that kids are in school in a safe setting. The vaccinating for children, this was great news, but let's not forget the fact that we were waiting for this a long time to make sure that our children could be protected. And this is a part of a huge effort. Across the state, we've had more than 140,000 kids ages 5 to 11 get their first dose. There are so many places to get this done. We've opened up now mass vaccination sites to kids. You can go online and get an appointment at one of them. We're having more pop-ups. We're making it so easy on parents. No excuses out there. We're going to do that. In fact, we're going to do it right here at the Delavan Grider Community Center Friday and Saturday. Come on down, mom and dads, and grandma and grandpa, bring the kids down here and make sure that we continue working with our community partners. And so we're going to be doing this, and you'll be stay tuned. This is in conjunction with what the county is already doing. We want to make sure that we're not duplicating efforts, but maximizing the resources of the county and the state here. So we also want to have an ad campaign. I know there's hesitancy. I know parents are anxious, even parents who've been vaccinated themselves. They might just be thinking twice about, is this something I want for my kids? I understand that anxiety. I'm a mom. You're hardwired to do everything you can to make sure your children, your babies, even when they're teenagers, they're still your babies. I understand that maternal and paternal sense of responsibility. So we want parents to have all the facts. We've launched a Get the Facts page to dispel information that's wrong, because there's a lot of disinformation out there, a lot of lies. That's what we're combating, that people are seeing something on social media, on Facebook, and they're treating it as if it's gospel truth, despite the fact that their own doctor may have a different message for them. That's what's so maddening about this. And we have to stop that and to call it out and get the information out there. So we're launching a new campaign to encourage people to get the truth, get the facts, and I will play this ad right now so you have a chance to see it.
The COVID vaccine for kids 5 to 11? Yeah, I had questions. So I called my kid's doctor. I totally trust her. We talked about the lower dosage for younger kids, possible side effects, and why the vaccine is so important. But I still wasn't sure, so I asked her, what about your kids? Are they vaccinated? She said, absolutely. And that's all I needed to know. Talk to your child's healthcare provider about COVID vaccines for kids 5 and older.
Well, that you're going to start seeing that on the news very soon, and I just want to say, I really want to make sure that everyone in this community and across the state have heard me loud and clear. If you feel at risk, and I will tell you, my judgment is you are at risk if you're living in a high transmission area, get the booster shot, get your children vaccinated. Let's be able to have the next time I come out here, let's get through these holidays, but be able to say that the masks are coming off. We don't need the restrictions. We can get there. I believe it to my core. We can get there. There's no reason not to. We continue to do this for our own safety, our family safety, but also our children, and as well as just being able to bring back this economy. People are just thirsting for that sense of normalcy, that they can put this behind me. And I know people are frustrated. They're exasperated. When is this going to end? And how is it possible we're still talking about this pandemic? This Delta variant took us all by surprise. It is raging. It is still out there. It is still virulent. And we cannot ignore this as much as we all have our exhaustion with talking about COVID. There's a lot more fun things to talk about, like a really big Buffalo Bills win the other day. I know and I was actually at that game. I didn't spike the football too much, but I did gloat a little bit. I want to thank everyone for coming. You are the people on the ground that care so deeply, whether you have constituents or patients or people that you serve in community centers like this. You're the ones that are making the difference. And I want you to know that the state of New York understands this. We're not coming in to be heavy-handed and dictatorial. We want to liberate the local governments to do what they do best, but be there as their allies at their sides to make sure that they have all the resources they need, whatever approach they want to take. But at some point, if the numbers don't start on a downward trend, we're going to have to talk about larger protocols, which we all know are available to us. They're all available to us. So this is the warning. The warning is going out loud and clear today, and I truly hope that the community at large will listen to this, because it doesn't have to be this way. It doesn't have to be this way. We can do better. I believe that, and I know you know that as well. So thank you all for being my allies in this. Someday we'll all emerge from the foxhole. We're just not there yet. So thank you very much. Mark Poloncarz, I believe you're on deck.
Thank you, Governor. It's good to have you back home. The Governor was not kidding when she talked about the foxhole, because there were many of us who spent a lot of time. We may not have been in the same room, but we were on the same Zoom, it seemed like, all the time, including Tom Crociocci and Mark Sullivan, Dr. Kane, and then there were others who were brought in at various times, Dr. Young, Mark Blue, and we worked together as a community to get through COVID, because it's all about saving lives. That's what we're talking about, and more than 2,100 Erie County residents have died from COVID. And unfortunately, in the month of October, there were more people who died in October of 2021 than died in October of 2020 from COVID-19 in Erie County. That's why we're here today. So thank you, Governor, for your renewed commitment to fight COVID-19 head on. And I know it is a strong commitment, because what I saw from her last year when we had the Western New York Regional Task Force together fighting COVID, even if we were in different places, so that we could create a safer, better community for all. Yesterday I talked about how this is a call to arms. Well, it's really a call to arms. Rolling up the sleeves and getting vaccinated in your arm, and getting a booster, and getting your children vaccinated if they haven't been vaccinated, because what we know is we can reduce the spread of COVID-19 if we take appropriate action. And the appropriate action begins with getting everyone in our region vaccinated. And we know that there are some that are hesitant, but it's quite clear from the cases that we're seeing, new cases, as well as especially the cases that we're seeing in the hospitals, that if you are vaccinated, your chance of being hospitalized are much less. Your chance of catching it is much less. And let me give you one statistics from the Erie County Department of Health that proves that with regards to children. And this is hot off the press. I just got from Dr. Burstein about an hour ago. For all of the new COVID cases in the 12 to 17-year-old age category, 45% of the children in that age category are not vaccinated, but they make up 85% of the new cases. Vaccination protects everyone, including children, and we know that there are unfortunately children right now, including infants in Oshai Children's Hospital, who are in the ICU because of COVID-19. We have to come together as a community, Western New York, and as I discussed yesterday with County Executive Adam Bello and his team, the Finger Lakes region, to combat this. This is not a City of Buffalo problem. This is not an urban problem, suburban problem. It is all of our area in Western New York and the Finger Lakes. And unfortunately, the counties that come between Erie and Monroe, more rural-based, have some of the highest numbers of new cases based on the percentage of their population and the positivity rate, even though you would think they'd have some of the lowest numbers because, of course, they're less dense population. But they have higher numbers because they also have some of the lowest vaccination rates that we see in New York State. So this is a call to arms. If you haven't been vaccinated, please get vaccinated, especially your children. Thank you, Governor, for opening up these pop-up clinics. The one thing we see is there's a tremendous demand for 5 to 11-year-old vaccines in our community. Every time we open up a clinic for 5 to 11-year-olds, they pretty much go like that because parents want their children vaccinated. Thank you for opening up the pop-up clinics here, and thank you for opening up your doors at the Delavan Gryden Center, Ms. Bobbins, because it really matters to bring the vaccines into the community no matter where it is. So we got to get people vaccinated. If you did get vaccinated, get a booster. If it's been 6 months from the Pfizer and Moderna, get a booster. If it's been 2 months from the J&J, get a booster. And as has been noted, you don't have to get the J&J anymore. You can get the mRNA, whether it's the Moderna or Pfizer, as your booster. Wear a mask when you can't otherwise safely socially distance, especially inside. We know that a lot of the new cases in Erie County are coming from individuals who are going to events with family or friends in their homes, and they're not wearing masks because they're with people they know. Unfortunately, they're catching COVID. We know in Erie County government, because we have a mask mandate in Erie County buildings, we're not seeing transmission between employees and guests because everyone's wearing a mask. Masks work. Another thing that's very important, if you are sick or your child is sick, stay home. Do not go to work. Do not go to school. We're seeing cases of individuals who are coming to work or sending their children to school who are sick. Children are being immediately sent home, and unfortunately the people are going to work sick. Then they get tested and find out they're positive, and they've now potentially spread it to others. And the other final thing we want to remind everybody is know your status. Get tested. If you're going to go to a big event indoors, it makes sense to get tested to see if you are COVID-19 positive. You may be asymptomatic, but asymptomatic people can still transmit the illness. So please get tested if you're going to be in that situation, because it's always good to know. And you know what? That little tickle isn't the greatest thing you'll feel for a few seconds, but it's worth it if you find out that unfortunately you have COVID-19, because then you can address it rather than do nothing. We need to work together as a community, as a state, to address it. That's what we've done for the last 2 years and will continue to do. I want to thank Governor Hochul and her team for their continued strong work to ensure that we come together as a community to address it. And that's what it takes. We're all united as Buffalo Bills fans. On Sunday afternoons, I guarantee you, people are watching the TV or at the games wearing red, white, and blue. Well, we need to be united as Buffalonians, Western New Yorkers, Rochesterians, and the rest to come together to fight COVID. And if we do that, I know we can end this quicker than unfortunately it's headed in right now. So thank you to all. Thank you to all my partners for their great work. It really does matter. And it's my pleasure to introduce my partner with the local COVID-19 task force, and someone who worked very hard to ensure that we addressed health equity. And I'm very proud to say, because we addressed the issues of health equity and equity with regards to COVID-19, we, as one of the few communities that were able to keep down the number of deaths among African Americans so that it actually met the population. That didn't happen in many communities across the United States. And one of the reasons is because of the great work of my friend, the head of the NAACP, Reverend Mark Blue.
Hello, everyone. I'm not used to public speaking, but we want to thank Governor Hochul for all the work that she has been doing in keeping the task force together, along with some of my task force partners in crime. It is very, very good to know that we're still doing a good work. We're meeting every other week to make sure that we get updates from all of the counties. And if there's a problem that we can help solve, that's what we're focused on. It's very important that we get vaccinated. Not only that, but it's very important that we get our young people vaccinated as well. When the schools were out, parents were going crazy. Now that school's in session, get your child vaccinated so you can have some sanity. It's very important that we do that because a lot of parents aren't educators. And it's no disrespect, but let's leave the education to those experts who are trained to do it. We need to make sure that our children are vaccinated. You've heard the statistics that the majority of those who are now being infected are our children, our babies. And we need to make sure that we curb that. The NAACP, as well as the National Action Network and the Buffalo Urban League, have joined forces in a roll up the sleeves campaign. And that is to make sure that we get to all of our Black and brown communities in all of our counties, and even with our churches, to give train the trainer information to pastors and leaders to make sure they know the importance of the vaccination. There's been a lot of activity out there to dispel the importance of the vaccination, but we are now working hand in hand to make sure that we train pastors and leaders and community leaders on the importance of the vaccination and what's in the vaccination. A lot of people have had hesitancy because they said it was done too quick. But this vaccination that we have with the Pfizer and the Moderna, they've been decades in the making. And we need to make sure we get that information out, because it's very important that we allow our community to know that this wasn't something that was done haphazardly. A lot of thought. The trials that were being done have not been shortcutted. We made sure, I'm sorry, not me, but they made sure that these vaccines are healthy and effective for our community. And that's what we want to do, carry that message, because it's very important that we resonate the importance of getting individuals vaccinated in all communities. So with that, I want to say again, thank you, Governor Hochul, and thank you to our team that have been put together to work this magic to get people vaccinated. Thank you. Thank you all for coming.
Good afternoon, everyone. Thank you for coming out. I'm happy to take a couple of questions. Yes, we are over 8%, and I would say any area that's over 5% should be concerned, but that is something, that number is flexible. There are areas of high concentration, particularly people who live in densely populated areas, people who live in apartment buildings, people that are taking public transportation. You know, people also have to analyze their own connection with other people. I mean, if you're living alone and no one visits you, and you're living in a high transmission area, your risk is a lot lower than someone who's heading into a workplace, heading into restaurants, going to events. So there is not a clear metric on this that has been given to us from the CDC. So I'm telling you, as governor, that I believe anything over a 4 or 5% in transmission rate is unacceptably high and is considered a risk area. Absolutely, Erie County, Finger Lakes, very large portions of our state, I believe, their people are at higher risk. Therefore, they should go do their own. It's a personal assessment. I'm telling them they're at risk. They determine they're at risk, and that is all they need to do is to go in and ask for the booster shot to say, I'm in a risky situation here. Mark? Mark? Right. What I am not looking for is a broad brush statewide approach to treat every region of the state identically when the circumstances are so vastly distant. I will be back in Manhattan in the next hour and a half if I can get out of here soon. I have to be at some other events. The infection rate in Manhattan, Bronx, Queens, Staten Island, Brooklyn, it's about 1%. Walk down any street in the city of New York, people are wearing masks voluntarily. You cannot go into a diner, where I was yesterday, without showing my Excelsior pass. So that has made a profound difference in those communities. And to the extent, and that was instituted by local government. Those options are out there. Every community needs to assess what's important for them, but I want to make sure the tools are out there so communities can make their own risk assessment, their ability to enforce, the likelihood that people will comply, so it doesn't turn into a demilitarized zone where you're anxious about enforcement. There are communities like New York City where they were hit very hard. Everybody heard the sirens every night. Everybody knows somebody who was lost. And my warning is that we don't want that same experience to be shared elsewhere in the state, because in the first wave, the second wave, it was not the case. And so there are lessons to be learned. There are options on the table. There are a lot more options. But I believe the best option is for people to realize the role that each and every one of them play in allowing us to finally say we are liberated from this pandemic once and for all. And we have everything available to us to make that happen.
Governor, your data shows just 8% of hospital beds are available right now in the Finger Lakes region. We have been for months reporting on major staffing shortages that are backing up the entire healthcare system. When you put the vaccine mandate in place, you said that there were fail-safes available to help with these staffing issues. Many of our hospitals say they have reached out to the state for help and they haven't gotten much.
Well, I would be happy to hear who they are, because we have a war room set up to respond to areas where there's high need. No, we also know that many of them can go into their surge staffing levels. Some choose not to. It's more expensive. So we first ask the hospitals in the congregate settings, have you activated your surge resources available or not? And then are you looking at visiting nurses and other options as well? And then also I have everything from 1,000 student nurses who are ready to be deployed like this. If it gets dire, we have the National Guard. We have EMTs who are willing to assist. So we have resources, but the first question we ask is, have you done everything you possibly can to avoid this? I mean, it's a collaborative approach that we're taking as well. We're very conscious of this. We're conscious of this.
They say they have. They
Okay.
just pull employees out of nowhere, essentially. We check with our nursing schools. Nobody's been called up. So what will it take?
You have to give us a specific example, and be happy to run it down for you to tell you what happened in that circumstance, because I'm hearing other stories elsewhere. And I also have available to us institutions in New York City where they had a very high vaccination rate. The people are all at work, 99% in some hospital systems. And I've asked them to be available to share staff upstate or other places where they're having the problem. So what would be more helpful is if, instead of debating whether or not it happens in one place, and I'm telling you we have an approach to deal with this, give us the examples and we'll run it down for you. I want- I am not mandating that people have to avoid indoor gatherings. I'm simply saying that the smartest gathering is going to have people who are wearing masks and hopefully vaccinated. I mean, people should encourage, before you have Thanksgiving dinner, I would want to know before I invite anybody outside my immediate pod that I've been with the whole time, are they vaccinated? That is a fair, legitimate question to ask. And if grandma and grandpa are there, I'd take the time right now to make sure that they got their booster shot. That's what I'm talking about. I'm not talking about mandates. I'm saying common sense says that unlike last year, when the gatherings were downright frightening because you had no idea if there was going to be a super spreader event at your Thanksgiving dinner, it doesn't have to be that way. The question is, are the people coming to your home vaccinated? And I understand the fatigue. We are all sick and tired of this. And that is why I am pleading with people, help us get through this. We can go from that 90% to 100%, we can go to 70%, wherever our numbers are not where they should be, particularly with the younger people who are vulnerable. There is no reason why, a whole year later, as we're entering our second holiday season, that we have to be dealing with masks or any restrictions at all. It's so avoidable. That's what I find exasperating. This is avoidable. And everybody who's done the right thing, they're just as frustrated with everybody else as well. So I'm just saying, let's just get this done. All right, I've got to head back. Thank you. There's nothing to announce today. Conversations are ongoing. They're very complicated negotiations, as you can imagine, anytime you're negotiating with entities like this, but they're very much moving on track. My expectation is that I'll be able to address this in my budget, and so that'll be the outer time frame of concluding the deal. But we've been having a very, very good relationship, and we're intent on getting this done. So we are intent on keeping the Buffalo Bills here for many, many, many decades to come. Thank you, everyone, for coming out. Appreciate it.